I'm going to move us on. Our next speaker is Melissa Swindell, who's one of my colleagues here, our Chief People Officer at Alder Hey. So over to you, Melissa.
Thank you, Dame Jo, and good afternoon, everybody. I'm really delighted to be here actually to share with you our story about what we've been doing at Alder Hey, which for me as a HR people professional of 20 years plus has been something very different, but really exciting. And I think we have seen some really interesting results from it. So I'm going to spend the next 7 minutes. I'm sure I'll be chivied on if I take too long, but spend the next 7 minutes just sharing that with you. So if I could have the next slide, please. So let me start by just giving you a bit more information about Alder Hey Children's NHS Foundation Trust. As Dame Jo referenced earlier, we are a big organisation, probably the busiest and biggest children's healthcare organisation in Europe. We treat roughly 350,000 children a year. We are based in Liverpool in the northwest of England and see and treat a range of children from the very simple ingrown toenail, broken arm in our accident and emergency department to seeing some children with some really specialised and complex needs, and that's everything from cardiac, neurosurgery and oncology. So and of course, not forgetting, we have a very strong mental health provision looking after children and young people in Liverpool and the areas beyond. So really diverse organisation, but everybody working towards the same goal, which is about how do we provide the best healthcare for children and young people that we can, that we serve. We've spent the last probably 12, 18 months really thinking about our vision, Vision 2030 we call it. What do we want to be seen as, known as, and what do we want to do for children and young people? And we think we've got a wider role than just healthcare. We are wanting to work with our partners and with the community. And our vision is to create a happier, healthier and fairer future for children and young people. So what's our role and how can we play a role in making sure that children and young people have the best start in life, the best health, but also the best life chances and the best opportunity to do the best that they can? So that's what we are really driven by. That's what we're passionate about. But of course, what we all know, and certainly what we are all committed to, is that we cannot do that without thinking about the same things for our people. Because without our people, we won't be able to deliver our aspiration and our vision. So what we've developed is a people plan and a people strategy that goes hand in hand with our Vision 2030. I think there's lots of quotes, isn't there, from people like Richard Branson and other business leaders that say, look after your staff and they will look after your customers. And it's the same approach for us here. If we don't do the right thing by our colleagues, then we will not be able to deliver what we want for our children and young people. And so when we were developing our people plan, we were really thinking about the themes and the philosophy behind all of the things that we want to do and all of the actions we want to take. And you can see them there, hopefully, on the slide that's on the screen. We want to really commit to looking after each other, creating a sense of belonging. Nai mentioned the diversity. We've got people from lots of diverse backgrounds and cultures. How do we make sure that everybody feels a sense of belonging in our organisation? We want everybody to be able to learn and grow for the future. How do we support that learning and development? So when we think about workforce planning and changing our services to meet the changing needs of children, we need our colleagues to be ready, to be skilled, but we also want to create an environment and a culture in which people embrace those new ways of working. We do it with them, not to them. So there's some really, really important principles that we set. However, because there's a however, isn't it? This did require us to start thinking a little bit differently. If I could have the next slide, please, Carl. Because we've got a great vision, we've got a great philosophy, and we've got great people working in Alder Hey. But when we started really looking at the data that sits behind our workforce, what we started to see, which we probably knew instinctively, but we'd never really had the data, was that our churn rate, as in our people moving in and moving out, was much higher, I think, and took us a little bit by surprise. So you can see there from that graph, we traditionally in the NHS in England split our workforce into professional groups. So we'll talk about doctors, we'll talk about nurses, we'll talk about physiotherapists. But you can see from that graph that almost 1 in 3 employees in our organisation were on the move over a typical year, adversely impacting on our productivity. And when you think that the data tells us that it costs on average in the UK about £12,000 to recruit a nurse. When you start thinking about that kind of money and the money that's walking out the door because we are maybe not retaining those staff as long as we need or training them in the right way, then it really required us to think quite differently about what we were doing. If I can have the next slide, please, Carl. So we leveraged our data in a completely different way. And I think back to some of the comments that Joe made earlier, we traditionally look at our workforce data in terms of numbers. We look at our activity. We've got both qualitative and quantitative data from our staff, but we've never really brought them together in a way that connects the dots as the graphic shows there. And for the first time ever, we triangulated the data. Took us probably about 12 months to do this and really work through the data, really get underneath it. But what that triangulation of data from both activity, qualitative data from things like our staff survey. So again, for those who are not familiar, the NHS run a huge staff survey every year, mandated, that we invite all of our colleagues to respond to. So we've got a wealth of data there that we were using, but perhaps not using as effectively as we could. So we combined that data with our demographics, and it brought out some amazing information, which enabled us to look at our workforce in a different way and really brought out those human stories. And I'd like, if I may, to just expand on that a little bit. Am I doing okay for time? 1 minute, okay. If I just give you one example, one of the things that it enabled us to do is look at our colleagues in a different way. So we found that we had a group of staff who had been at Alder Hey a very long time, 8 years plus. The data was telling us that their sickness rates were low. Sorry, their churn rate was low, so they stayed, they were loyal, but their sickness rates were high. And the staff survey data was saying they liked it here, but they weren't particularly engaged. Now, what that enabled us to do is really think about needs and behaviours. What does that data tell us about what these people are thinking? If I can have the next slide, please, Carl. So we were able to look at that data for each of those staff groups and really think about what does this mean we need to do in order to meet our vision. And there's some learning there. We really needed to think about, look at our data outside of professions. One doctor is not the same as another, but perhaps they've got more in common if they've been here longer. We need to focus on capacity and some of those things that we were doing that were counterintuitive. We really weren't necessarily thinking about those things that make the journey for employees easier. What we really did, and I think this was key, was really enabled us to think about the value propositions and the interventions for our staff that were focused on those needs and behaviours and motivations, as opposed to some of those traditional ways of working. And then finally, because I'm being asked to wrap up, we started with staff are the main course, not the side. Well, I think staff are the starter, the main course, the dessert, the hors d'oeuvre, and the dessert wine at the end. You can't do anything without thinking about your people. So if I've learned anything from this process, it's about you should have the data in your organisation. Perhaps just think about using it in a different way. I hope that's given you a real flavour of what we've been doing at Alder Hey. Thank you.
Thank you. Thank you very much, Melissa. I think we'll come back to some questions for you when we've been through the other